Dr. Abhishita here. So today I'm going to be talking about abdominal pain. So a lot of people call this stomach pain, right? So stomach pain is actually more specific to the organ stomach and some pain associated there. Abdominal pain is something, or abdomen related pain is more specific to your whole abdomen, which is the whole area below your rib cage up to your groin area would be what we would call abdomen. Now, if you take the abdomen, let us first understand what are all the organs in various parts of your abdomen, because then it will be easier to understand what is the cause of your abdomen pain or your stomach pain. So first things first, let us divide your abdomen into the right side and the left side. So if you have abdomen pain on the right side or the right upper side of your abdomen, what are the organs there? You have liver and you have mostly gallbladder. So if you have some infection related to your liver, or you have a fatty liver, or you have an infection of the gallbladder or a gallbladder stone, all of those can cause abdomen pain on the right upper side of your abdomen. Again, if you have abdomen pain on the right side but on the lower right side of your abdomen, then what are the organs there? You usually have your large intestine there, you have appendix there. Most common pain or emergency situation related kind of a pain would be appendix. So inflammation of appendix, infection of appendix, all of this can cause severe sudden onset pain in your right lower side of your abdomen, usually associated with fever, chills, very cold periphery, sudden blood pressure drop, fainting, nausea, vomiting. So that's an emergency situation where you should go and meet a doctor immediately. So, and that pain is very characteristic, very, very severe. You will not mistake it for any other pain at all. Sometimes in women, if they have a right lower abdomen pain, it could also be related to your ovaries, like an ovarian cyst or something like that. Now, abdomen pain on the left side. Now, what are the organs on the left upper side of your abdomen? Mainly you have spleen, you have your rib cage there. So any kind of an infection related, say, to your spleen or an injury there could cause pain. On the left lower side of your abdomen, if you have pain, you have your large intestine, and for women you have your ovaries there. So you could be a pain related to, say, an infection of your large intestine or an ovarian cyst, or if you have irritable bowel syndrome, very characteristically before you have a bowel movement, you can have a left lower side abdomen pain which gets relieved after your bowel movement. Then if you have abdomen pain in the center but on the upper center, like right below your rib cage, then there could be two things that you have to think of. Is it some acidity, acid reflux, gastritis, peptic ulcer disease? Or if the pain is in the center, but you're also having breathing difficulty, chest pain, pain radiating to left shoulder, jaw, neck, back, all of that could be associated with more a heart or cardiac related pain. Now, if you have abdomen pain around your umbilicus, navel, or belly button, what you usually have there are small intestines. So this could be more related to an infection of your intestine. Now, the lowermost part of your abdomen, just around your groin area, you have two important organs there, which is your urinary bladder and reproductive organs. So if you have a pain there, it could be an infection of your urinary bladder, or it could be, in women, it could be fibroids, it could be endometriosis, it could be just a simple period pain that you're experiencing every other month, and in men it could be, most commonly for them, it is urinary bladder infection or a stone. Now, apart from understanding where exactly your pain, and the next most important point about abdomen pain, apart from location, is the type of pain you're having. Is it a generalized pain? Is your whole abdomen hurting? That is more commonly found in a stomach flu or say just an infection or food related infection, especially if you have abdomen pain after you've had food. So suppose you've had some outside food and within 24 hours or 48 hours you have developed an abdominal pain which is associated with nausea, vomiting, loose motions, then definitely it is related to that outside food, and it could be an infection or what we call food poisoning. Right? Sometimes you can get mild abdominal pain after eating food if you've consumed too much food, if you have acidity issues or peptic ulcer disease. Also, you would have a little bit of abdomen pain after consuming food. If you have indigestion issues, you can have gas, bloating. If you have irritable bowel syndrome, if you're gluten intolerant, you're lactose intolerant, all of these conditions, they generally tend to worsen a little bit, especially if you've had food that is not suited to you or you're intolerant to. Now, apart from this, what we have to understand about abdominal pain, not only can it be generalized, it can be localized. So localized is what I've already spoken about, which is specific areas of your abdomen are hurting. Then you can also have something known as cramping. So cramping of your abdomen is more like a sudden onset pain, and the pain is lasts usually less than 24 hours, and the causes are not usually very severe. So a typical example of cramping of abdomen is when you have gas, when you have bloating, you have indigestion. Then there's a type of abdominal pain which is known as colicky abdominal pain. Now colicky abdominal pain is very sudden, severe in onset, lasts usually more than 24 hours, and it comes in waves. So there'll be waves where the pain is completely severe, unbearable, and suddenly there'll be a wave where the pain is not so severe, like a waxing waning pattern. But this pain is usually associated with something quite severe, and so you should not neglect a colicky type of abdominal pain. You should immediately consult a doctor. Now, what the next thing that you need to understand about abdominal pain, apart from location, the type of pain, is what are the other symptoms that the abdominal pain is associated with. So is it associated with fever or chills, nausea, vomiting, loose motions? Is it associated with any burning in your urine? In women, is it associated with any white discharge? Are you finding any radiation of pain? Which is to say, especially, I think this is an important point to put here, when you have kidney stone related pain, you will have a pain that radiates from your back to the front of your abdomen and then tends to go towards your genitals, your inner thigh. That's a very characteristic kidney stone pain. So that's a typical example of radiation of pain. Another example of radiation of pain is sometimes when you have pain in your right upper part of your abdomen and it radiates to your right shoulder, your back, then it could be related more to your gallbladder. Again, this is an emergency. And if you have pain, say in your epigastric, your center region, and it's radiating to your left shoulder, left hand, left side of your jaw, it could be more heart related pain. So that's an example of radiation of pain which should not be ignored and which should be brought to a notice of your doctor immediately. Now, if you're pregnant and you have abdominal pain during early pregnancy, see, the early pregnancy, first trimester, you will have mild abdominal pain which will not bother you or your day-to-day activities, doesn't disturb your sleep. But if the abdomen pain is disturbing your day-to-day activities, it is getting worse, associated with any burning in urine, please immediately bring it to the notice of your gynecologist or treating doctor. Then if you have abdominal pain which is associated with, say, severe breathlessness, or pain that disturbs your sleep, or pain that is disturbing your day-to-day activities, these are points that you have to keep in mind. What are those factors again which help relieve your pain, and what are those factors which are worsening your pain? And is there any change in your bowel habit? So these are the few points that you need to definitely watch and keep in mind when you have abdomen pain, and you should immediately inform to your doctor. Now, when do you consult a doctor when you have abdominal pain? First, if the pain is lasting more than 24 hours, if it is associated with fever, chills, nausea, vomiting, diarrhea, more than 5 episodes a day, if the pain is steadily getting worse, you're not getting any relief with over-the-counter drugs like paracetamol or any antacids like, say, Gelusil, Gaviscon, Sucralfate, none of these are working. Or if the pain is associated with blood in stools, blood in vomit, black color stools, or if the pain is associated with a lot of radiation to your left shoulder or your right shoulder, then pain that is associated with difficulty in breathing, all of these could be signs that you should immediately consult a doctor or go to your nearest hospital. What are certain home remedies that you can follow that can help relieve the pain? Well, first, of course, take rest, hydrate yourself well, drink at least 6 to 7 liters of water, avoid any spicy food, have simple home cooked non-spicy food. Then you can also take some over-the-counter drugs like, say, paracetamol, or some antacids like Gelusil or Sucralfate or Gaviscon. You can apply a hot pad over the area which is hurting, especially if you have period related pain. Then definitely you can try applying a hot pad, which gives a lot of relief from period related pains for you. So these are certain causes of abdomen pain, and when you should consult a doctor, what simple home remedies you can do. What's important to understand, more often than not, the cause is usually not severe. It's quite a simple cause. more related to digestion related issues. But yes, there can be certain issues which are serious, should not be neglected, and that's why the important thing to remember, any pain that lasts more than 24 hours should definitely be brought to a notice of a doctor or a physician so that they can understand what's going wrong with you. Now, if you go to a doctor, is there something that they would do apart from taking history? Yes, they do some basic investigations. So they can do like a simple complete blood count, a liver function test, or a kidney function test, or your stool examination. They can do an ultrasound of your abdomen. They might do an x-ray of your abdomen, all of which is quite common in abdomen related pains or stomach pain, because that will help definitely diagnose the probable cause of abdominal pain, and obviously based on the cause the treatment would accordingly be given. So if you have any further questions or doubts, please feel free to reach out to us anytime. Thank you. Namaste.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.